Hello everyone. Today I'm going to be discussing something we won't be find in the books. Let's say these things we can observe in the ICU setting. Even in the normal patients, you can observe these things. This is known as energy pacing technique. Actually, this is not a technique at all. This is how our body reacts. Okay, it's like let's say if someone having a breathing difficulty and he's like intubated for so long time, he's in ventilator, and we are like observing his quadriceps muscle, usually the thigh muscle, is getting like very thin. We are saying it's a muscle wasting or atrophy. Actually, this muscle wasting of the quadriceps as well as the decreasing oxygen capacity as well as decreasing the lung capacity, they are correlated, because ultimately body will supply oxygen to the vital organs and also to the bloodstream. The thing is, they are extracting the oxygen from the quadriceps because lungs are not able to provide the sufficient amount of oxygen. Therefore, if you are like observing like the quadriceps muscle is getting weak, can say weak, but obviously we see the wasting of the muscle. Then a hamstring, then biceps, because this is how our body surviving when there is less amount of oxygen that is from the lungs. If the lungs and our diaphragm and other accessory muscles, whatever the muscles we are using to take enough oxygen, if they are weak, the blood and the body will demand oxygen from our quadriceps, biceps and hamstrings. Then those muscles will go for the wasting. Therefore, in the ICU setting, maybe if the patient is bedridden, we have to see, okay, the patient don't have that much difficulty in like oxygen in breathing, but we already know that patient is having a weakness in the breathing. But at the same time, we are observing the quadriceps muscles and everything getting weak, wasting. It is applicable for everything in our body, but we never thought like this energy pacing technique is there. Therefore, you won't be finding this in the books. Might be you are finding in the research. Then you can apply this logic to everything. Then it will be easier for planning the protocol treatment for the patient, because the oxygen level is nothing like patient have less lung capacity and patient cannot take enough breaths, but there is something to do with this quadriceps wasting also. Therefore, we have to see all the things when we are considering a treatment or protocol. I thought this is very interesting to share. Thank you. I will come with another interesting video.